My name is Ayu. I'm a GP from Indonesia. I'm actually coming from a global assistance and healthcare. Our entity is a Fullerton Health. So today we're going to bring a short presentation about the utilization of CAD4TB for mass and remote TB screening here in Indonesia. We will share our experience using CAD4TB for the TB screening. So we're actually a private entity based in Indonesia with more than 50 years of experience in healthcare service provider. Our headquarters is actually based in Singapore. And at the first time, we are not really engaged with tuberculosis world. So back in 2019, our headquarters in Singapore is having a CSR for a TB screening here in Indonesia. So that is our first activity for TB screening, which is in the South Sulawesi here. So we're doing a TB screening in the community, and we found out that the case detection rate that we found is even higher than our national detection number. So this kind of being a spirit for us to work and help our entity to be part of the effort of finding the missing cases of TB in Indonesia. And it still continue until now, and we finally here and involved in the use of AI for our TB screening activity. And so this is the current situation in Indonesia. So based on the global TB report in 2020, it is estimated that we are having 845,000 cases. While as per April this year, we actually notified 350,000 cases. It means that we're still having more than 400,000 missing cases. So this is a really huge homework for us. This is why we are a private entity is trying to come into the initiative for helping the NTB to find more missing cases of tuberculosis in Indonesia. We're having the goals from the NTP, from the roadmap of TB elimination. We want to have this goal 50% of reduction in TB incidents and 70% of reduction in TB deaths compared to 2014 by 2025. So hopefully we could achieve this number. And this is actually the problem. I'm sorry. Yeah, so this is actually the problem that we face in Indonesia. So during this COVID-19 pandemic, we're actually having an increase of missing TB cases. So previously in 2019, we are successfully notified, the NTB successfully notified 569,000 cases. But due to the COVID-19 pandemic, it's decreasing to 350,000 cases in 2020. So it means that the missing cases that we have to find is increasing because of the pandemic. And the other thing is because of this pandemic, the government is implementing a restriction in order to control this COVID-19 transmissibility. So we cannot do any kind of screening because of this restriction. It's really difficult to create a mass or put everyone in a big number in a group to do the TB screening. It's kind of difficult because this condition. And also previously on the screening strategy, we implement a question-based survey as the first elimination prior to the X-ray. So we only took the chest X-ray to those who are suspected from the question-based survey. So it's kind of make the suspect more smaller in the number. So this is why we thought maybe we have to change the strategy in order to gain more suspect from this for this TB. And also the switch resources. I think it's not only happening in Indonesia. I believe in other countries you're experiencing this problem as well. Because of this COVID-19 pandemic, all of our, not all of our resources, but most of our resources, which is previously used for the TB diagnosis, are also used for the COVID-19 containment. Like the two expert in our country, we have to split between diagnosis of TB in one day and then diagnosis for COVID-19 in the other day. So all of this problem is becoming a burden for us to develop the case finding activity. So based on this problem, we are trying to develop a strategy to create a better strategy for the case finding. And in the 2021, the WHO guidelines on tuberculosis is releasing the statement saying that the chest X-ray is a tool for screening TB. So we could conduct a symptom screening, chest X-ray, or molecular TB test alone or in combination. So we are trying to switch from the previous strategy, which is a symptom questionnaire first, to become everyone should got the chest X-ray to gain more number in the suspect TB patient. So this is a kind of our algorithm here. So we're not doing the centralized screening in the hospital or in a clinic. We're doing the same like the other country. We're doing on site. So basically we're coming to the community with our mobile unit. We usually start with the registration and screening of the participants. Sometimes after that, we will give a short education about tuberculosis to remove the stigma and other stuff. And after that, basically, there will be two different activities that should be undergo by the participant, which is the symptom screening and also the chest X-ray. So everyone will got the symptom screening, and then they have to continue with the chest X-ray screening. Those who are suspected from a symptom screening, which is interviewed by a paramedic, they could go directly to the molecular TB test. In this case, we usually use the gene expert. And then after that, they have to go for a chest X-ray screening. And actually, in here, I put two different arms. In the first arm is actually in the conventional way where we are not involving AI in this arm. So those who are participant on the screening, we took the chest X-ray, and after we got the image, we are still using this conventional manual way, which is we will send the image to our radiologist. And sometimes our radiologists will come back with the result fast, but sometimes they come back with the expertise like the next 24 hours after we send the image. And then in the day 2 or the day 3, we could got the result of the screening, is it suspect or not. When they are suspect, then we could continue to the molecular TB test or doing the gene expert. The problem in the first arm is when it took more than 1 day for a screening, difficult for us to sometimes find or call these people back to the screening, because the stigma, or even sometimes the people are saying they have to go to work or other stuff, is really sensitive to become a lost to follow-up cases. That's the problem when the screening took more than 1 day. And we are trying to implement the AI, which is in the second arm here. So after we expose the patient with the chest X-ray exposed, then we got the image. It will directly send to the AI, which is in here. We use the CAD4TB box, and they will give us the result in less than 1 minute. Is it suspect or not? We usually use the cutoff score is more or equal to 60. So those who are higher than 60 will go for a molecular TB test. And it's still a regulation in our country that every radiology images should go to a radiologist for further expertise. So we are still asking for the expertise from our radiology specialists. So those who are positive from the radiologist but is not yet positive from CAD4TB still has to go for a molecular TB test. So in this case, in this arm, we're not missing any cases. So the benefit from this using the AI is we could finish everything in 1 day, which is very precious for us, because sometimes even if we come to the community, sometimes people are not coming from like 1 kilometer or 2 kilometers away. Sometimes they're coming from like 5 kilometers away, and the next day when we have to call them, it's kind of difficult for us. Sometimes people don't want to come because of the like I mentioned before, the stigma and other stuff. So by make this efficient and effective screening, it's really important for us for not losing another suspect for a TB patient. Yeah, this is kind of a screening process that we usually done. So we start with the symptom interview. This is done by paramedic. This is kind of tricky during this COVID-19 pandemic because people are tends to cover their symptoms. It's kind of sensitive to say I'm coughing in this situation right now. So yeah, the symptom screening sometimes it becomes not so objective for sure. So that's why we have to we have to double with the effort of the chest X-ray. This is our mobile unit, and then we expose the patient and we analyze with CAD4TB. The regulation in our country is we are not allowed to send any medical data to the cloud. So that's why we are using all the offline method. So we are using the CAD4TB box here. So we're not sending anything to the cloud. So we keep everything in this box. And once we got the analysis, we could decide it if someone is suspected for TB or not. Once they are suspected, we will ask them for collecting the sputum for further diagnosis. And so this is the challenge during the operation. So in the field operation, we understand that the doctor's ability for expertise for reading the chest X-ray is very widely. Sometimes they are very expert, but some are less expert in reading the X-ray abnormalities. So this AI is kind of become a standard tools, standard scores to be concluded as abnormality. And it's really fast to gain the result. That's really helped during the crowd in the screening area. And the second, our radiologists, sometimes they cannot be involved in the mobile radiology unit because sometimes they cannot leave the hospital and their pathological patient. Specifically in this COVID-19 pandemic, their presence in the hospital is very important. So this use of AI is really help us, and the 0 to 100 score, I mean the numeric score in this case is really helping us to decide a use suspect or not. It could be interpreted even by our radiographer technician. So we don't need any other expert to help us to decide is it suspect or not. And there's also a challenge for us in the acceptance of AI. For sure, this is something new, and we understand that anything new in the world is sometimes creating kind of resistance, and it's happening also as well. So there's a bit resistance in the early use, but WHO is actually in the guideline development group is already stating that CAD software programs can be considered accurate when compared to human readers. So this recommendation is actually increased the acceptance of the artificial intelligence itself. On the we also found the compatibility because we are mostly using the Asian brand digital radiology software, which is sometimes not compatible with the CAD4TB box. So we have to do some little adjustment, and it was always assisted by Delft staff. So we're doing a small update remote from the Netherlands, and it helps a lot. And after that, we could operate the CAD4TB box as usual. And so this is a result comparison to the human readers. This is based on our experience. So in the suspect TB case, in here is the population with the score of CAD4TB is greater or equal to 60. So in this group, the radiology is concluding the same like CAD4TB, so 65% having the same opinion like CAD4TB, saying that this is abnormal, while the 35% of them saying this is normal, while the CAD4TB say this is suspect for TB. But those who are in the normal cases, which is less or below 60, our radiology is having almost the same opinion with the CAD4TB box. So 98% of them saying normal and also only 2 saying abnormal. So we conclude that this CAD4TB is in line with the radiologist expertise and have a good sensitivity in the high-risk TB population. And yeah, so this is coming up to the conclusion. So the use of this artificial intelligence is really reduce the duration of the screen. So the entire screen is completed in 1 day, which is very important for us with the archipelago challenge with the 17,000 islands, and for us to complete everything in a short time. And the chest X-ray and analysis from the AI can help with early screening, and for sure it's reducing the using of molecular TB tests. And which is during this pandemic, we also could help to completing the data from the symptom screening, because maybe they are actually coughing, but they said no. But when we do the chest X-ray, it found out that there are TB, those kind of things. So this could be very useful during this COVID-19 pandemic. And also in the urgent situation of the remote area where radiologists cannot attend the event, AI can become a standard tool to help analyze the TB-associated chest X-ray. This is to help the GP. Sometimes the ability is still vary, so this kind of AI is actually helping set the standard and happy to decide is it suspect or not. And so in the end, the present of artificial intelligence is reducing time consumed, increase quality of the screening, and reduce for TB diagnosis. And it could be a potential to improve the mass screening. So I just want to that the AI is for assessing. This is not for creating the diagnosis. So after we got a conclusion from this AI, we have to ensure again with a gene expert on the AFP setting to make sure is the patient is really a TB patient or not. Yes, I think the end of my presentation. So this is our team in Latin Indonesia. So we're actually also a member of the Ending Workplace TB initiative in World Economic Forum in Davos back in 2020. So we're also part of the effort for ending workplace TB. Thank you very much. Hopefully this could help you in using the AI.